I am Patty Rose. We are back on the road again today. I'm very excited to be at Sandhills Medical in Lugoff, South Carolina, with their new CFO or Chief Financial Officer, Joe Derry. Joe, thank you so much for having us this morning.
Absolutely. Looking forward to it.
Well, I'm excited to learn more about Sandhills Medical, about your new role and all the wonderful things that you all have going on. So first of all, can you just tell us a little bit about yourself, Joe, your history, your background, and how you ended up at Sandhills Medical?
Yes. So I started in the FQHC space about 10 years ago in Monroe, Louisiana. Before that, I was a chemical engineer, a lot of manufacturing, also in the cell tower business for about 10
Oh, wow.
years. So
That's interesting.
yeah, a very interesting past. The opportunity came up for a CFO position at Morehouse Community Medical Centers up in Northeast Louisiana. And it intrigued me. It was a mission-based organization in a nonprofit space that I had no knowledge of before. Didn't know what an FQHC or a federally qualified health center was.
Okay, thank you, because I didn't know what an FQHC was, so
Yes.
Federally Qualified Health Center.
That's correct. Yes. So we get a federal grant from HRSA to provide healthcare services to the uninsured and underinsured populations throughout the country. There are, I think, over 1,500 FQHCs across the country with 1,700 plus clinics serving over 52 million patients nationwide. So big program.
Definitely.
That I never heard of.
And I'm sure there's a huge need.
Huge need every day, especially with healthcare and of course our economy and yeah, we all experience challenges and healthcare is one of those needs that needs to be addressed, not only on a individual basis, but also when you think about the healthcare system overall and
Yes.
the cost of that system. FQHCs are in a unique position to help lower those costs by providing primary healthcare services, keeping patients out of emergency rooms, which
Absolutely.
is extremely expensive to the system. So we are key to the solution on providing healthcare services at an affordable cost to patients and the system.
And having a positive impact on the overall healthcare
Absolutely.
system in a
Absolutely.
given community. And that leads to, many families struggle with healthcare costs. I keep seeing reports and it just seems like every year it continues to go up, 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 even the cost of basic health insurance. And that's why so many end up in a situation where they can't afford health insurance. Can you tell me how Sandhill Medical, you mentioned helping the uninsured, underinsured. Can you explain to our listeners and readers how Sandhills Medical does that and what's your mission as far as addressing that need in our community?
Sure. Yeah. Our mission is really to provide access to quality, affordable healthcare services. It's all about access. And what we do is we have programs in place to reduce those barriers.
Okay.
And one of those is addressing financial barriers. So we have a sliding fee discount program. Patients are eligible based on the federal poverty guidelines that
Right.
are issued every year, January, I believe, of every year. And based on the patient's household income and number of family members, then they would qualify for a discount program. And we have 5 different categories based on household income and family size. And it can be discounted down to $20 per visit. To
Oh,
make it a
wow.
lot more affordable.
Definitely.
And again, to break that financial barrier.
So how does that work? Let's just say, for example, I'm that person. I don't have health insurance. I need care. do I call Sandhills Medical locations? And I know you're all over. We're in Lugoff today, but I know you have locations, I believe, down in Sumter, up in Kershaw, all over kind of, and maybe even in more rural type areas where access is a struggle for some folks. But if I want to take advantage of this FQHA system and I have a need, do I show up with my proof of income? What is the process? How does somebody go about accessing?
Making an appointment like any other healthcare provider. And then what you would do is complete an application. And that's where we get the information like the family size, household income. You provide the sources of income to determine where you would fall on the scale.
Right.
But it's a very easy process. We have patient service representatives that kind of guide you through that. Even if there's some information that's missing, you can always go back and bring it the next time that you come in for an encounter appointment. And that will be in our system. And so that process is good for 12 months.
Okay.
And then you just reapply.
Update.
That's right. You just re-update. That's correct.
Okay. So it sounds fairly straightforward.
Yes.
And simple for folks.
Very, very straightforward.
And did you say can we access an application online, or I don't think you mentioned.
Yeah.
Or come in, which is better.
Come in. Yeah. It's easier to come in.
Okay.
And the patient service reps will kind of walk you through the process, make sure that everything is clear, and that you bring in all the proper documentation.
I think it's so important for people to know in our community that, because I hear it often, and I just come into contact with a lot of different people groups, but they will avoid care because they don't feel like they can afford to pay for it.
Right. And
to me, that's very, very sad. I feel like health is foundational to productivity, to being able to work, to be able to care for your family. So many things, just everything stems from good health. So I'm excited to know that Sandhills offers these types of services to folks who may be just avoiding taking care of themselves because they don't feel like they can pay for it.
Absolutely. And where I've seen the biggest impact really are in the schools, because there are a lot of kids that we see that may not otherwise see a provider. So not only if you're sick, but a well visit,
right?
The annual physicals,
the eye test, the ear test, that
all
kind of
of
thing.
It. Yes, and it really, it's encouraging to see the kids really would get the care, number one, because they may not get it otherwise. But number two, again, talk about impact. You can see it every day. And we provide that service again.
So you mentioned the schools. Is Sandhills Medical in our school system?
Yes.
Nice.
We have recently collaborated with the Kershaw County schools.
Wonderful.
And so, we're providing services within the school this year. We're actually attending a lot of the back to school registration. So to learn more about Sandhills Medical,
right.
We're going to have staff there talking about what services we provide. It's very important to get the consents for the kids, right?
Yes.
Up front. And we're going to be providing services throughout the Kershaw County schools.
Well, I think that's just incredible. What a wonderful partnership between Kershaw County School District and Sandhills Medical, because that's where you're going to reach the kids.
That's right.
That they're there, that's your best access, I think, for being able to access that population. And then hopefully it'll grow from the student, them getting care in the school system, and then the families.
Absolutely.
As well.
Teachers,
yeah.
The families, absolutely. Yeah. We want to be that one-stop shop, right? We want to provide all the healthcare services for all our patients. And with the in-house pharmacy, that's another huge value
So you
for
can
our,
come for your doctor visit, get your prescription, and then
yes,
right here on the same campus, so to speak,
absolutely.
pick up your prescriptions.
And we have the providers on campus as well. So if there are any questions with adherence to, the prescriptions and the care plans, we're there. We're another just an all encompassing resource
Well,
for our
I think
patients.
that offers better medical care, honestly, because there's no disconnect between this provider and that provider and the pharmacy and all those things. That's very, very cool concept.
Yeah, and the sliding fee also applies to our pharmacy program as well.
So that helps.
Absolutely.
Wonderful. Changing gears a little bit, you mentioned came from Louisiana. Just why Sandhills Medical? What attracted you to Sandhills Medical, and what experiences from your role in Louisiana in the FQ? What do you call it?
HCs.
HCs. Thank you, FQHC in Louisiana. How will that help you, or how do you plan to implement some of what you learned there here, and bring those?
Absolutely. Well, we were looking to relocate in the Southeast, and we came across the Sandhills Medical opportunity. We came here to visit, and I met with Amanda Duke, our CEO, and really embraced that vision. I was very impressed with what has been going on especially the last 6 to 8 months. And the vision that she had is something that really spoke to me because my personal mission statement is to make a difference to those around me.
Okay,
And
that fits.
yeah, absolutely. And making that type of difference into the community and the patients in the community is really spoke to me. And the way that she felt about and feels about just the healthcare system. And even though it's broken, being a part of the solution in this
Yes.
area is that was a key for me on my decision to. And so I've been with an FQHC for 10 years, and we grew that FQHC tremendously, more than doubled the size and number of clinics, patients. We opened in-house pharmacies, and I have a lot of experience that I feel like I can bring to Sandhills and this area. So very excited to be a part of the organization.
Well, we're excited that you're here and that you and your family chose to come to this area. So it'll be fun to watch as time moves forward. I pulled some statistics that 65% of patients in your service area are uninsured or covered by Medicaid. Medicaid reimbursements, I think everybody knows they're not the highest in the industry. While 85% live at or below, and there's a 200% of the federal poverty level. And I don't know that most people understand that. Can you explain what the 200% of the federal poverty level means? And then what financial challenges does that create for Sandhills Medical? And how do you remain sustainable while still being able to provide services to everybody that comes through your door at different rates?
Sure.
It's a lot. I know. One question.
It's just this whole the FQHC space. It's a challenge. It's not easy. You don't get into this business to make tons of money. I mean, it's really mission based. It's about making a difference. And it is a challenge because you are a nonprofit, but that doesn't mean you can't make money. And we have to make money in order to invest and provide more services for our patients, more access with more clinics, so it's a challenge already. So what we have is the government, in order to provide access to the underinsured population, we do receive a federal grant to offset some of those, whether it's the uninsured or the Medicaid, it offsets some of those costs. And so we also have from a Medicaid standpoint, we get paid a certain rate every time we see a Medicaid patient. So we have an incentive also to provide services to the uninsured and underinsured populations.
And Medicaid, it sounds like, and Medicaid patients,
And
which
Medicaid
is
patients,
not
absolutely.
necessarily typical in a for-profit model.
Right. And I know of several providers that refuse to see Medicaid patients, and that's due to the lack of reimbursement. So yeah, that it's a challenge, but what it does, and that's where I think my background really comes in to play, is being an engineer, being in manufacturing, experience running a company, to be able to run very efficient operations so we can provide those services, high quality, affordable healthcare services, and be able to continue to grow, invest, and again, make a bigger difference to the community.
That's awesome. It just amazes me. I know I personally get a little frustrated with the structure. Like you said, the system is sort of broken. But what a bright light the FQHAs and Sandhills Medical are in the middle of this situation that so many Americans find themselves in, especially in our area. Given the statistics that I found, I was really shocked and a little disheartened to see those numbers. So it's really wonderful that you all are here. And I feel more and more at ease that you're the man at the helm of managing the money and figuring it out, and that your heart is where it is. That's really important. You answered my next question as far as, why are you such an important part of the healthcare safety net? And definitely that you are. But what opportunities do you see for growth, investment, expanded services? Or are you still trying to wrap your arms? I know you've only been here a couple months. Are you just still trying to wrap your arms around, or are you already seeing opportunities?
Absolutely. We've already decided that we're investing in a new clinic in Kershaw County.
Wonderful.
In Camden. We will start renovation soon, and early next year we plan to open up our new clinic. We'll have a handful of providers providing medical and behavioral health services.
And that's a very important need that goes unmet so often.
Absolutely. And we're also going to have an in-house pharmacy.
Wonderful.
Behavioral health services has just exploded in the last 10 years, 10, 15 years, and the need. And that's one of the areas that we're focused on in schools, which is probably, in my opinion, one of the most needed services within the the school system. So
young people have more struggles with mental health issues, I believe, now than any generation previously. And I don't know why. I don't know if it's technology. I don't know if it's sort of COVID. I know one of my children was in high school during COVID and basically missed a year and a half. I mean,
and I think it's all of that, whether it's the technology or how the society has changed, but also I feel like it is now a lot more open. And, whether it's sports or celebrities, whatever, that they're more apt to talk about the mental health challenges and issues.
Not quite the stigma.
It's more of that's correct. Yeah, it's not. Yeah, that's right. It's more normalized as far as it's okay to talk about, and we all have those challenges, right? But behavioral health services that are provided are necessary and really make a big impact.
Well, and I'm glad we talked about it, because I didn't know that Sandhills offered. I was thinking medical, and so not as much mental health, behavioral health type program services.
Yeah, and there's been a lot of work and investment over the last probably 5 to 7 years, not only to grow behavioral health services, but it's the integrated behavioral health services with medical.
With physical, yeah.
Yeah. And it's also with the pharmacy as well, those services, and navigating all of whether it's the anxiety or just the lack of knowledge and the frustrations of just everything, and the prescriptions you have to take, and all of the related issues. So yeah, behavioral health is a key part of the whole system.
That's great. I think that's just great. What message would you like the residents of Kershaw County? I know Sandhills Medical is also outside of Kershaw County, but within Kershaw County, since we are the Kershaw County Current, is there a message that, and to the surrounding communities as well, that you would like folks to know about accessing Sandhills Medical, especially as we've already talked about those who think healthcare is out of reach for them?
Sure. A lot of it is just awareness. Like I said, I've never heard of an FQHC before, and the programs that we provide, the uninsured, Medicaid, all of the, any patient, and we don't only see the uninsured and underinsured. We see everybody.
Okay, good point.
Yes,
Very
you
good
could
point.
have commercial insurance, Medicare. Yeah, we see everybody,
Okay.
regardless of ability to pay, and that's the key part. But yeah, it's awareness. That has been one of the challenges for the FQHCs, I believe, that we have such great programs. And again, the pharmacy program is an excellent program that also has a sliding fee scale. And we do everything we can to identify any discounts that you're eligible for as a patient. And it's a great service. So yeah, awareness is probably the biggest takeaway from this.
So tell your friends,
Yes,
tell your family
friends.
members.
We are investing in a new clinic, and we really enjoy our collaboration with the Community Health Center, the City of Elgin, the Kershaw County Schools, and we want to continue to be a key partner to the community, and continue to make a bigger difference to our patients.
Well, and I know I always hear I've been in media and marketing my whole career, and folks are like, I never knew, I didn't know, and I'm like, I don't know how you didn't know, because we put, you try to put it out there everywhere. So I'm glad the Current can be a small, tiny part of helping you get Sandhills messaging out and helping folks understand what's available to them in Kershaw County and surrounding areas. Speaking of that, what is the best way to guide somebody that's looking for information? Is it going online? I mean, can we Google Sandhills Medical?
Absolutely.
How's that
Yeah,
work?
sandhillsmedical.org is our
Okay.
website. We have a big presence on Facebook, LinkedIn, all of
The platforms.
the platforms. Yep, all the socials. Or just drive by, come on in the clinic, and we can guide you to.
And get you started.
That's right.
Is there anything else that you'd like to share, Joe?
I really appreciate the opportunity to talk and share about Sandhills Medical, and I've been embraced, and I really love this area, and I feel very fortunate to be able to make that difference. So I'm happy to be here, and I appreciate the opportunity.
Well, we really appreciate you taking the time to meet with the Kershaw County Current, and we'll do everything we can to spread your message. And welcome
Thank you.
to the Midlands of South Carolina from Louisiana, the bayous of Louisiana.
Yes.
We're glad you're here. And so thank you again so much for your time this morning.
Thank you.